Welcome to episode two of our series with Access Child Neurology. Our topic is challenges with transitioning to adult neurologists. Elizabeth, thank you for joining me on Access Child Neurology, continuing our discussion about challenges. Can you share one of the biggest challenges that you have faced?
For me, the change in the sort of communication and also connection between patient and provider was particularly challenging. Because with my pediatric provider, we've reserved a period at the end of each of my appointments to share fun, candid, personal information, where I had the chance to learn about her family and she learned about my future plans and some of the fun little things that were going on in my life. And it was very encouraging to have a positive part at the end of every appointment, especially after there were sometimes difficult discussions and situations. And I also felt confident that my provider knew me for more than just my epilepsy, that I wasn't defined by my disease in any way. And this was very different after the transition. My adult provider is very nice, and I certainly feel that he is working in my best interests and cares about my situation. At the same time, our conversations rarely deviate from my epilepsy or other health related topics. So I do not really feel like we know each other almost at all on a what I would consider to be a personal level, a non professional situation. And personally, this change in the ambience and feeling in general makes it somewhat more challenging to discuss difficult topics, as the connection does not feel quite as strong. And it decreases the sense of cooperation, even though I at the same time know this is not in any way a measurement of how much my provider actually wants to be my partner and teammate and work to support me in my epilepsy. And do you have ideas of why adult and pediatric neurologists are so different?
So I think they're kind of two groups that don't overlap as perhaps as much as they should. Uh, that they are two different training pathways. So child neurologists actually train more in adult neurology than the reverse. Adult neurology pathway is 4 years of training, only 3 months of which is necessary in child neurology. Um, and the reverse is true for child neurology. So if you're training in child neurology, it's 5 years, two prerequisite years of general pediatrics, a full year of adult neurology, and then 2 years of pediatric neurology. So I think a pediatric neurologist fresh out of training feels more comfortable treating adult neurologic conditions than a adult neurologist fresh out of training feels in treating pediatric conditions. So there's also less emphasis on various things. So there's less emphasis on genetics. There's less emphasis on neurodevelopment. Um, and I think the dialogue, the conversation on a national level is changing. There was a commentary in one of the sections through the American Academy of Neurology about this subject, and perhaps changing the educational and training background a little bit, maybe to include more training in the care of adults with intellectual and developmental disabilities, for example, which would probably be more useful for an adult neurology trainee as they get out into practice. Um, so I think those would be the major things that I would see that we could potentially change, that kind of going forward as an educator. I was a child neurology residency program director for 18 years, so I'm always looking to make some changes in the educational foundations. And this is one area where we could make changes, perhaps.
That is very interesting. I certainly did not know there were such big differences in the way that training works between the two groups. And related to these differences or anything else, when you were working as a pediatric neurologist, were there times that you didn't feel comfortable transferring patients over to another adult neurologist?
I think that You certainly, everybody has an opinion, and so I certainly had my opinions about who I thought would be more well suited to receive my patients, and actually, so as I mentioned, I've been in practice for more than 30 years, and so 30 years ago there was less of a dichotomy, I'll say, between pediatric and adult neurologists, and actually here in Louisville, the um, adult hospital was just across the street from the pediatric hospital, owned by the same healthcare corporation, and had some shared services. And so there wasn't as sharp a division, I'll say, as there has been in more recent years. And we're, of course, trying to overcome that. So, but yes, so I think there have been times where, uh, I was hesitant to kind of let go of my patients, um, you know, but increasingly, I think we need to be prepared for the concept of transition, because um, the pediatric hospitals are becoming more firm, I'll say, about the rule of, you can't be an inpatient if you're above a certain age and that sort of thing. Whereas, kind of back in the day, I'll say there used to be a greater degree of flexibility.
Okay. And do pediatric doctors have to transition the patients to adult care?
I would say by and large, yes. Uh, so uh, there may be isolated circumstances where where there's more flexibility for a pediatric neurology provider to sort of hang on to their patients. Uh, uh, but I think by and large, most pediatric neurology occurs in academic centers, and the rules of the practices do not really permit sort of hanging on to your patients beyond about 21 or so years of age. And so I think virtually all patients have to transition to an adult provider.
Okay. That is definitely what I have heard from all of my other friends and other people who have neurological conditions. So, uh, and now that you are working in adult neurology, do you find your colleagues ask you questions when they take patients who are transitioning from pediatric neurology?
Yes, so I get lots of questions. I staff the resident adult neurology continuity clinic weekly, and we frequently see patients with pediatric onset conditions, either congenital or acquired in the pediatric years. And so I'm frequently asked the sorts of questions, or um, just last week, as an example, we saw a young adult with new onset of seizures, and I noticed that she had a port wine stain on her neck, and it turns out that it extended into her scalp, including uh, more towards the front. So um, we're suspicious that she might have Sturge-Weber syndrome, and the so kind of help to guide the evaluation and management of that. And so we don't know yet, but we're working that up. But I do have a probably greater comfort zone, I guess, in knowing about, for example, neurocutaneous conditions, or uh, neurodevelopmental disorders that later become uh, intellectual and or developmental disabilities. And so I get lots of questions in that area. So I can talk a little bit about the resources that are available in our clinic for our patients with more complex neurologic conditions in the adult neurology clinic. So uh, there, the Child Neurology Foundation, for one, provides a rare diseases or rare disorders finder, I'm going to say, which is on their website. So if, for example, in the case of the patient that we think might have Sturge-Weber syndrome, if we confirm that diagnosis, then we will certainly provide her with, um, direct her to resources available both through the Child Neurology Foundation and other websites for that specific condition so that she can be aware of the condition, but also the issues that might arise in the future and kind of what to watch for and how to alert us should problems arise. Um, the the resources, the Child Neurology Foundation, of course, has wonderful libraries and other patient-oriented resources. But then there are also specific resources depending upon the condition. And if it's a very uncommon condition, there is a National Organization for Rare Diseases. So occasionally we will see somebody with an even more uncommon condition and direct them to that website, or in some cases print out that information and provide it with the after visit summary information that they're printed out at discharge. So I think more information is always better.
And I have definitely seen a lot about the benefits of having resources specifically for transition, and have also had the chance to work directly with developing some of these resources and helping with them. Because there are a lot of resources that are available online, and frequently you can reach out to local or state health departments for resources on transition. In Michigan, where I am from, we have a whole website that's all on healthcare transition. And there's sections on this that are for youth, parents and families, and healthcare providers. And through this, there is a training course that's specifically for youth on how to make the transition. There's quite a few different tools. There's documents on resources for transition, which is one that I helped make that's all about different apps that are available for transition. And there's things that are for general components of epilepsy and other conditions as well that can help with making the transition smoother if you also are comfortable with understanding your condition. And additionally, as you were mentioning, there's quite a few organizations on the national and local scale that have resources for the transition. There's organizations such as That Transition, which is a big one that has, they are entirely devoted to the healthcare transition, and they have lots of website pages, videos, and audio recordings, toolkits, timelines, and just a wide variety of resources. I also specifically am a member of the Young Adult Council for the American Academy of Pediatrics National Coordinating Center for Epilepsy, and we have done quite a bit related to healthcare transition as well. We made a healthcare transition toolkit in the past couple of years that is a bunch of resources related, both for providers and patients, with how to make the transition. And as you mentioned, clinics themselves also frequently have forms of assistance for patients and the families, and these can be especially helpful if they are specific for the clinic. They have details about what it's like for working the transition individually in their clinic, because it does have differences depending on where you are making this transition. So the big thing is there's lots of resources out there if you know they are available and work to use them.
Perfect. Well, thank you so much for joining us today, Elizabeth. And I want to appreciate everybody. Thank everybody for tuning in today.